listeners, welcome to Views on Health. After quite some time, I have with me on the program Dr. Kishara Gunaratne, consultant neurologist and senior lecturer, Faculty of Medicine, University of Moratuwa, and also Dr. Kishara Gunaratne is the president of the Epilepsy Association of Sri Lanka. Wearing quite a few hats, Doctor, and welcome to our studios and the program.
Thank you very much, and
yes.
Thank you for inviting me.
Our pleasure, Doctor. And the topic under discussion today is seizures. Quite a wide topic. I would like to hand the microphone over to you, Doctor, to tell us about seizures.
Yes. First of all, seizures are actually a manifestation of often what we call epilepsy. Now, this a seizure, as we all probably are familiar with, is where the person would lose consciousness, and then the whole body would start to stiffen. And then often we observe whoever's experiencing seizure where the eyes would roll up, and then as time goes by, they start shaking or juddering away. The hands and feet would generally shake, and that would go on for about a minute or so, not more than that. And then slowly these shaking movements would generally dissipate or stop gradually, and the patient or the person who's experiencing the seizure would generally recover, albeit fairly slowly. And this is different from a normal faint, where a person would generally lose consciousness, but there's very little increase in there's not much stiffness associated with this loss of consciousness. And also, though there may be some movements involving the hands and the feet, these are not as pronounced, one. And secondly, they last for a very, very short time, lasting a few seconds, not more than that. And the recovery is generally quite rapid. So that's quite different from a seizure. But often, because of these movements, they are often misdiagnosed as seizures. So it's very important for if anyone actually experiences something like a seizure, it's very important to observe what really happens, because when you recount the features of what a certain eyewitness would observe, these details are very important in trying to differentiate what a seizure is and just a normal faint, where in the case of a normal faint, often we don't treat. However, when it comes to a seizure, there's a high chance that the person might end up as being diagnosed as epilepsy. Now, if someone asks me, so what's the difference between seizure and epilepsy? A seizure is a single event, whereas epilepsy is a condition where you're more likely to experience more and more seizures. So just because a person experiences a single seizure does not automatically mean that particular person's got epilepsy. However, if he does experience more and more seizures, then of course that condition is called epilepsy, and that particular condition needs long-term treatment. So I hope that's clear.
Yes, Doctor. Thank you so much. I'd like to clarify something now. When you say that we should observe the pattern, so to speak, what sort of specific advice would you give a lay person to observe? What should we observe? How should we observe? And for how long should we observe? And what should we do?
Okay, so it's a good question. I think there's a lot of fear, anxiety that one would have when one sees a person seizing. And that's a natural human reaction, and often because of the anxiety that the person witnessing has, they often forget to do certain things that might make the person who's having the seizure safe. So there are things that you need to do during a seizure, and there are things that you shouldn't do during a seizure, and there are things that you need to observe during a seizure. So I'll take them one by one. So what are the things that you should do during a seizure? And that's very important. Everyone should, a lot, maybe around 99% of almost all seizures terminate automatically or self-terminate. They stop by themselves. And that's very important for us to sort of have in our minds. That's because often there is this misconception and of that, even when we are during this day and age, there are lots of people who come to me who have actually they bring a sort of a key or a spoon, and they try to shove something, a metallic thing into the mouth, or try to pry open the mouth while the patient or the person is having a seizure. They also try to put something in the hand, that kind of thing, where which is probably not the correct thing to do. So these are all based on misconception, where something metallic might sort of stop the seizure. Even if you do all this, the seizure anyway stops in 99% of cases. So what you really need to do during a seizure is, one, do not panic, and that's very important. Make sure if the person is actually seizing on a chair or on a height, it's better to sort of bring the patient down on the ground and observe over a period of time the seizure, and that's very important. Also, make sure that the patient or the person who's experiencing seizure is safe. What do I mean by safe? You need to make sure that there aren't any sharp objects that are close by, because these movements are very sort of violent movements that are associated with seizures, and they are obviously not conscious, and therefore they may injure themselves and so on and so forth. So it's important to move things that are around the person away, so that they won't injure themselves, and that's very important. The other is to keep something soft, maybe fold a shirt or something that's soft underneath the head, so that the head is nice and padded, and there's no trauma to the head. And then, of course, time the seizure. Now, as I said, almost all seizures, or nearly 99% of seizures, self-terminate. And then it's often not more than a minute. Very unusually, it would go on for about 2 minutes. But if a seizure continues for 5 minutes or more, the chances of that particular seizure stopping becomes that much less. And that's when we really need to take this particular person either into hospital, or I think it would be best, since the 1990 ambulance service is available, I think it would be prudent at this point of time to actually give a call and inform the ambulance services, because this particular patient or person really needs to get into hospital, because the only medication that can stop that kind of seizure is probably going to be intravenous medication, and that's important to have in mind. So timing the seizure is important. So while we are timing the seizure, as I said, what happens during a seizure, the whole body goes stiff, and then there are these movements of the hands, the feet, the whole body starts shaking, and that and then it stops. As soon as it stops, it's important for us to turn the person over or the patient over, either onto a side, either the right or the left, it doesn't really matter. And that's because when a person is seizing, there's a chance of the contents in our tummy, in our mouth, going the wrong way, going down the windpipe, which is called aspiration. What's the danger of that? That can cause one blockage of the windpipe, can cause reduction in airflow into the lungs. That's one. Secondly, it can cause what's called aspiration pneumonia, which is a pneumonia or an infection in the lungs because of the contents in our tummy and our mouth going in the wrong way. And that can be life-threatening. And that's why we turn the person over, but that needs to be timed as soon as the shaking stops. As soon as that happens, they need to be turned over, and that's what you need to do while a person is seizing. What do you need to really look for? So, as I said, the do's, the don'ts, and then what you need to observe. The don'ts, obviously, don't put anything in the mouth. Don't try to pry open the person's mouth, because often there's stiffness and they bite on their tongue, and that's seen in about 1 in 5 of all patients or persons who actually experience seizures. And people become, apprehensive. They really want the person to be safe, and that's why they try to pry open the mouth. But that can be more dangerous, right? Can cause more trauma, and that's not really recommended. So it's important for us not to do that. What do you need to observe? The general position of the person, whether he becomes stiff, whether the eyes are open, and how long the seizure lasts, and basically how quickly the person recovers. Those are the things that we need to look out for, because those are the features that generally need to be communicated to a medical professional so as to make a positive diagnosis.
Thank you, Doctor, for that detailed and lucid explanation. Now, what triggers this? And also, once it happens, is it the beginning of more seizures to follow periodically or at some point in time in that person's lifetime?
That's a good question. All of us, if you take the general population, there is a chance of us having a seizure, and that chance of us having a seizure in the general population is approximately 10%. So if you take 100 people, 10 would have a seizure during their lifetime. It can be during childhood, it could be, I'm sure most of us have actually heard of febrile seizures during childhood, or seizures during adulthood. So seizures can affect anyone at any time, right? So it's about 10%, and that's seizures per se. Out of which that's a single seizure, lifetime risk of a single seizure. Out of which a minority, that's approximately 2 to 3% of people who have a single seizure go on to have many more seizures and are diagnosed as having epilepsy. So it's a minority. What could cause seizures? There are several categories of or causes actually of seizures. Seizures can be caused by many things. They can be due to a direct insult to the brain. For example, someone has a road traffic accident. There is trauma to the brain. If it is significant enough, that can cause seizures. Stroke can cause seizures if the blood supply to the brain is compromised. That can cause nerve cells to die as a result of lack of oxygen and so on and so forth, and which is called a stroke. And as a result, in certain people, they may experience seizures. So those are examples of direct insults or direct insults to the brain. Of course, it doesn't really need to involve the brain directly. For example, there can be changes in the salt in your blood, which is called sodium, or what we call electrolytes. Right? Everyone's heard of electrolytes these days, and when there are disturbances in your electrolytes, that can also cause seizures. Everyone's heard of diabetes. A lot of people have heard of low blood sugar. When there's low blood sugar, you can lose consciousness. You can also experience seizures. So, which is called hypoglycemia, a condition where there's low sugar in your blood, which can cause again loss of consciousness and other neurological problems. So those are conditions where which can cause seizures, but are not direct insults to the brain. So that's with regards to seizures. But then there are people who've got epilepsy, where the condition is more prolonged, protracted, and these patients really need long-term medication, which are called and the drugs that we generally give these patients are called anti-seizure medication, and there the causes are a bit different. It can be again due to birth insult, lack of oxygen, any structural problem in the brain, which can certain parts of the brain that can give rise to seizures. Then there are genetic causes, so sometimes epilepsy can run in families. Then there are certain infections, long-term infections. So, for example, malaria can cause long-term epilepsy. A history of meningitis, a history of encephalitis, long-term can cause seizures or epilepsy. Then, of course, there are conditions where our own antibodies attack the nervous system or the brain, and that can cause epilepsy, and that's called autoimmune epilepsy, because it's the immune system that's basically trying to attack our own brain. And of course there's a certain percentage, which is a fair number, where we really don't know what causes epilepsy.
Thank you, Doctor. Time is catching up with us. It's been interesting listening to your explanation on seizures. So, briefly, how would you treat it?
There are various treatment options. The common treatment option is to start on anti-seizure medication. And there are a number of anti-seizure medications in Sri Lanka. And the message here to all patients who have experienced a seizure or who have been diagnosed with epilepsy is that there's medication available, and it is easily treatable. 70% of all epileptic patients can be treated effectively with anti-seizure medication. Of course, there's a minority of patients where anti-seizure medication may not be as useful or as effective in completely controlling the epilepsy. And in certain types of epilepsies where we are able to identify a single focus in the brain, we also consider other treatment options like surgery, where we take out a piece of the brain which we think is the cause of their epilepsy, rendering them seizure free. But of course, that is in the real minority of patients. So those are the main two options which we would generally use. Of course, there's a more recent treatment option that has been introduced to Sri Lanka. That's something called a vagal nerve stimulator. It's like a pacemaker where the wires really don't go into your heart, but they go to a nerve that comes out from the brain. They wrap the electrodes around this particular nerve, sending in signals from that particular nerve into the brain, and that is also a treatment option. Apart from that, kids who are very resistant to medication, we treat them with certain diets. You've probably heard of the ketogenic diet. Certain diets like ketogenic diet can be used as a treatment option.
So you do have your options that are in practice, and end of the day, all of this works.
In most cases, yes. So it's the message to all who are having epilepsy is that please don't stay at home. Don't think that this is something where various other types of alternative treatments can be used. It's actually mainstay treatment, which are drugs or medication, anti-seizure medication. It's easily available in most hospitals in Sri Lanka, and you can be easily and effectively treated.
Thank you, Doctor, because the fact that we've been saying this time and again over the series of programs that our healthcare system is tremendous, and there's so much of care and treatment given for free, which is something that our people truly, I think, appreciate in our country. So having said that, you give your message as well as to what this is all about, and we would expect our listeners to follow the good advice given by Dr. Kishara Gunaratne, consultant neurologist, and also a senior lecturer in medicine at the Faculty of Medicine, University of Moratuwa, and the president of the Epilepsy Association of Sri Lanka, for being with us in the program. Thank you so much, Doctor.
Thank you very much.
For sparing your valuable time and sharing your expert knowledge with our listeners on seizures. And we look forward to your participation too on the program next week. Having said that, may I thank you once again, Doctor, and also thank you, Piyumi Idrisinga, for technical assistance. I'm Fatima Razi Kadi saying good night, and looking forward to your company next Monday, same time on Views on Health.